Hello everyone, my name is Zues LeHoang. I'm a traditional Chinese medicine doctor. Today is my pleasure to speak with you on an interesting and important topic, treating insomnia patients with traditional Chinese medicine. Insomnia is a very common problem that could happen to anyone regardless of their backgrounds, their age, their race, their social status, their family status, their family history, their profession. And there's not much difference by definition of insomnia among different schools of healing, such as traditional Chinese medicine or Western medicine. But the treatment for this common problem is very different and in Chinese medicine, unique. So what is insomnia? By definition, insomnia is an abnormal sleeping condition and usually happens during the night, but could also during the day. You could have a hard time falling asleep, or you can fall asleep but keep waking up, or you wake up very early in the morning, or in the worst case, you cannot sleep at all. You stay up throughout the night and wake up in the morning feeling exhausted. And if this condition happens for a long time, it could lead to multiple unhealthy conditions or illnesses. So even though insomnia patients have various backgrounds, they all share the same desire, which is to have a normal sleep again, like a baby's sleep. So how to have a normal sleep again? We need treatment. In my experience treating insomnia patients, it has to do with this tiny thing called ear seeds. It's very simple looking and sticky because it needs to stick to the ear of the patient. It is actually an herbal medicine. The seeds comes from the herb called Wang Bu Liu Xing in Chinese, or Vaccaria plant in English. And it works so wonderfully. In my treatments, it's about 80 to 90% were success cases. About the ear seeds. The herb is Wang Bu Liu Xing in Chinese, or Vaccaria plant in English. In traditional Chinese medicine, Wang Bu Liu Xing belongs to the herbs that invigorate the blood category. Like the name indicates, the herb tends to stimulate the blood flow, usually used to help the circulation of blood in cardiovascular conditions or menstrual irregularities. It is also good for treating acute pains caused by blood stagnation or certain tumors, cysts, and hardened clots. The Chinese name for this herb is explained in a number of materia medica texts as referring to its strong action in promoting movement of blood. It actually means that even should the king command it to stop, its movement cannot halt, because its stretching, facilitating nature is so violent. Interestingly, this herb promotes lactation in the upper part of the body and unblocked menstruation in the lower part of the body. Why ear seeds? Ear seeds are adhesive-backed Vaccaria seeds that can be easily placed in and around the ears. Ear seeds are non-invasive, needleless, appealing to people who are more hesitant to try traditional acupuncture. Ear seeds have been used for thousands of years as part of the holistic treatment called Auriculotherapy. The 2014 edition of the famous book, The Auriculotherapy Manual, which is the Chinese and Western systems of ear acupuncture that provides a comprehensive guide to the practice of the Chinese and Western systems of ear acupuncture, notes that in order to sustain the benefits of auriculotherapy, the seeds need to be left in place for multiple days and stimulated consistently for best results. Research has also found that there are self-healing physiological processes taking place during auriculotherapy, and that applying pressure to your ear seeds can improve peripheral blood circulation by delivering more oxygen and nutrients throughout the body. My treatment is the use or the application of the ear seed on the patient's ear. In Chinese medicine, the ear is a very interesting concept. It is the image of the whole body, it's a reflection of our human body, which has two very vital systems, the hormone system and the nervous system. When a body is healthy, these two systems work well, sending the signals and the body's responses appropriately. But when the body is not healthy, is sick, these two systems don't work well. So when we apply this ear seed in the correct places in the ear map, by the way, in Chinese medicine it's called acupuncture points, that help to bring those two systems back to normal, to the way they should be, and they will send the correct signals, the correct body responses, and make the body behave as it should be. That's why it is very unique and very natural, and that's the beauty of the treatment. In insomnia treatment, the sleep should be brought back as a natural sleep. It should be sound and beautiful sleep, like a baby sleep. Now, I applied the ear seeds according to the so-called NADA protocol. NADA stands for National Acupuncture for Detoxification Association. The protocol is a simple, standardized auriculotherapy, and the protocol is a selection of 5 acupuncture points: sympathetic, shenmen, kidney, lung, and liver points. Some history about NADA treatment. The fact that acupuncture can help to reduce withdrawal symptoms was discovered quite by accident by Dr. Wang, a Hong Kong neurosurgeon. Early in the 1970s, he was using ear acupuncture as an anesthetic in an operation on a patient suffering from withdrawal symptoms from opiates. He found that the acupuncture also removed the withdrawal symptoms. He repeated the experiment with several other addicts and found it worked. He wrote articles on the subject, which were read in the USA by, among others, Dr. Michael Smith, a psychiatrist at the Lincoln Hospital in the South Bronx, New York. Dr. Smith and his team tried and developed the method. The theory was that the endorphin released by acupuncture occupied the opiate receptors in the patient, thus greatly reducing withdrawal symptoms. At the Lincoln Clinic, staff experimented with different points in the ear and came up with a 5-point combination that is today known worldwide as NADA. At each treatment section, needles are inserted in 5 points in both ears. The points used are sympathetic, shenmen, kidney, lung, and liver. Benefits of NADA treatment. NADA ear acupuncture or ear seed application has several effects. For patients who are extremely anxious, treatment is usually experienced as giving a great feeling of peace. Many fall asleep during treatment, particularly at the start of a series of sections. Many describe a feeling of relaxation and at the same time greater power of inner concentration and consciousness. The quality of relaxation provided by NADA is focused and positive. Those patients who are tired and indifferent can find themselves gaining vitality. They say they are being able to cope with things they have long ago ceased to bother with, and that they get more things done than they have previously managed to do. NADA treatment sections become more and more effective the further down the road the patient goes. The more treatments the patient is given, the more long-lasting the effects. In the beginning, sections need to be frequent. Later on, they can be paced out, yet still allow the patient to experience feelings of greater harmony. My first insomnia patient had an accidental effect of the NADA acid application. She was initially treated with acupuncture for Bell palsy when I asked her what else she had as the chief complaint. Insomnia, she said. I could never sleep for more than 2 hours every night. The next day after my treatment with the ear seeds, she looked refreshed and happy, just like a long time drought after a rainfall. So different that made me wonder and ask her, so tell me what happened. How do you feel? And she said, I don't know why I could sleep for 6 hours last night. I couldn't believe the effect. And from then on started my journey of treating insomnia patients. My father, who was 85 years old, was checked into the hospital because he couldn't sleep well and feeling anxious. I applied the adhesive on him, and right after that, he was able to have sound natural sleep. And he was released from the hospital after 1 week without taking the sleeping pills given by the hospital. He was happy and trusted me more. Of course, I was happy being able to treat my own father with my own hands with the knowledge of traditional Chinese medicine. Another man, 40 years old, was also checked into the hospital for his kidney failure problem. For 2 weeks, the sleeping pill didn't do the job for him, but the adhesive did. We worked like a charm on him, and he was able to sleep immediately after just one-time treatment. A nursing mom whose baby kept waking her up every morning around 4 a.m. and she couldn't go back to sleep also sought help from me. And the acids also worked a wonder on her. She was able to sleep so beautifully that her husband didn't dare to wake her up, and he stepped in to nurse the baby for her, and they were happy together with the healthier baby. And the effect of this treatment lasted for a few months when I received another call from her asking for another treatment. And I referred her to another TCM doctor because I was not in town. But she would like to wait for my treatment, and I felt honored and pleasant about her grace and her patience. So there were different success stories, and you see, they all varied. Of course, like the old saying, there's no sweetness without bitterness. I actually also had challenging cases when the patient took longer time to respond. It didn't give the effect immediately, so I had to combine with different treatment plans so that I could eventually able to sleep. And I can share those stories with you as well. But this time, For the educational purpose, I would like to do a demonstration of how I apply the adhesive to the real patient, so that you can learn to do it yourself. You can do it at home, apply the adhesive on yourself, and of course on your family members and your friends when you need it, and become your own doctor. Then the doctor, like us, can become your good friends. All it takes is your good understanding, the basic understanding of the ear map that I will show you, the ear seats, and your good heart is to do the small things well, beautifully, in the perfection. So would you like to see how I apply the ear seats? Then stay tuned. Hi again, everyone. I'm back for demonstration time. Supposedly, you already know the NADA protocol with the 5 acupuncture points like this. So you have the Shenmen, and below it is the kidney point. And across from Shenmen, you have sympathetic point. And you also have liver point here and lung point here. You will have plenty of time to study these points, their locations, their functions, so you know exactly how to apply them on the correct location. For now, for the educational purpose, I will demonstrate how to apply the adhesives firstly on the model and secondly on the real patient. So hopefully you will first have the general idea how to apply them on the model, and then you practice again on the real patient so you have real life experience. To do this, you need the patient's ear facing you. You need the working space and the tools to do it. And the tool is the ESCs like this, and the process, so it helps you to take the ESC out more easily. You need to clean the patient's ear, so you also need the cotton ball soaked with the 70-degree ethanol. Now, the first step is to clean the patient's ear using the cotton ball. You do it on both ears. After you clean the surface, especially the fine points well, then you will take the earpiece out like this. So it's very sticky. And then you apply on the patient's ear on Shenmen like this. And you gently press it so that it's firm and neat. And one by one, you will apply all the other points with the ear seat, just like that. So for now, you can do the liver point like that. The order of the points doesn't really matter. I usually start with the Shenmen, but other doctors may have a different order. So, and you do the other ear exactly the same way. And after that, you can gently press the ear set on this location to make sure it's neat and firm. Usually, these ear seats can be retained for a week or two, but for the hygiene's purpose, you can replace it with a new kit after 2 or 3 days. So that's it, how you apply. And now I will be back with the real patient to show you on the real patient. Okay, so here we have the real patient, Miss Tu, and we will apply the earpiece on the ear. So this is her ear, and the first step is to clean her ear like this, nicely and well. And we do it on the other ears as well. Then the second step, we will apply the ear seed. First we take the ear seeds out, like this. And now we apply first on the shenmen. And then gently press like that. The second one is a sympathetic point, which is very interesting. You need to apply inside it instead of outside. So then you press it against the ear point. Then the kidney point is below the shenmen. So you can apply like that. And fix so that it goes to the correct location. And the first one is the liver point. It's right here. And you also gently press it. And the last one is the lung point. You will press it until you put it in as well, gently. And that's 1 year. After that, you do the same way with the other ear. As you can see, this is how the ear would look, like that. And she can consistently press the ear seeds during the day, during the treatment. And hopefully, she will get a natural sound sleep very shortly. So, thanks everyone for attending this section.